Hi everybody. Today I wanted to talk to you about how to deal with acute injuries. So that's anything from a bruise or a scrape to a sprain or strain to even surgery, right? That's quite acute if you get cut into and the body has that same acute healing response. So admittedly this came about because I kind of injured myself last week and I have a certain treatment protocol that I go through and I thought that might be helpful for everybody else. So the story there is that I had a nice heavy object, actually an art print, kind of hit the back of my hand. It was pretty heavy print, it's about 25 pounds, not super comfortable, but it hit kind of in between these two fingers on Sunday, actually. So yeah, not too long ago, of last week, sorry, not this current week. But you can see a little bit of the scratching, and then I had kind of a little, definitely hit the impact of the bruise of the bone here and here. But yeah, you can see mobility is just fine. Everything is healing up quite nicely, and I thought I wanted to share that process with you guys. So here I have my lovely display for you. I promise I will get some more fun colors in the future, but for right now I've got black and blue. So we're gonna go with black and blue. But so these are kind of the two competing injury recovery protocols that are out there right now. And I think most people are really familiar with this one, the rice. So yes, this is not a comment on diet. This is a comment on injury healing. They just came up with cute acronyms that happen to both be foods. So rice, yeah, is that really common rest, ice, compression, and elevation, right? I am sure we've all heard that. That seems to be kind of the modern medical wisdom of the past couple decades to do this rice. So I am not a fan of rice at all. I should have brought another marker to like cross through it for you. I am much more a fan of meat or variation of meat. So here we've got movement, exercise, analgesia, and treatment. So yeah, it's a much better way to go, really. It's super helpful, really increases healing and decreases pain, much more so than rice overall. I've had a lot of injuries that I've treated with rice before I knew about kind of this naturopathic medicine approach. And I'm sure you've all had the same. We all know what this feels like, right? Where we go home and we rest and we elevate and we might compress something after the pain has come down. And we put ice on, right? That super cold application, 20 minutes on, you know, usually it's 20 minutes per hour, but I think a lot of people will do 20 minutes on and then kind of give it a break for 5 minutes and then do 20 minutes on, and you know, so it's kind of, yeah, but it can be really painful, right? So I remember that a lot when I had a lot of acute ankle injuries. I would ice those sprains all the time, and it was so cold, it was painful, right? And then you just hope that it goes numb so the pain from the ice can stop, and then it numbs out the pain from the injury. So it's not super fun. Yeah, so really, the trick to this is I might recommend a few of these just in the first 2 to 4 hours after an acute injury. So a very, very small time frame. And it also is really meant to go along with how you are feeling and how your body's responding to what's going on. So resting, absolutely, you do want to decrease movement at first, you know, especially if things are really swollen and kind of blown up. I never recommend ice. Never, ever, ever. And I will tell you a little bit more about that in a moment. Compression, I also really haven't used compression a lot unless there's a lot of swelling going on, and persistent swelling. I think that's the important thing to look at there. And elevation as well, of course, in the first 2 to 4 hours, if it's really swollen, great, that can be okay. But I'm not even that big a fan of elevation. So let me tell you why I am not a fan of rice. Overall, every single one of these steps involves decreasing circulation, which is absolutely the exact opposite of what you want to do when you have an acute injury. The main way we heal, in terms of any type of healing, is improved circulation, right? When we get the blood flowing, we get great nutrients in that we need, that the cells need to be able to heal. And then we have circulation pulling these waste products, the inflammation, metabolic waste products, all kinds of good stuff out, right? So that's exactly what we want. We want nutrients in, waste products out. Resting will decrease your overall circulation. So you're not getting that same blood flow. Ice, of course, shuts down circulation completely. This is why I never recommend it. This is the last thing you want to do for any type of injury, because when you shut down circulation completely, you're letting all of those waste products sit, right? And you're not allowing new immune cells to come in and start cleaning up. You're not allowing fresh blood flow in. You're just causing the tissue to sit and kind of shrink and just stay really, really tight, which is exactly what we don't want to do, right? We certainly don't want it to heal in that tight, contracted state with all this inflammation around, right? So ice is totally out to me. I do have an alternative, don't worry. I don't let my patients sit there or myself suffer without ice or some form of pain management. No, not at all. There's just a better way to do it. So if that's like the one take-home message I can give you guys, it's to really, really please stop using ice. For acute injuries, it's really not helping. Again, unless it's in the first 2 to 4 hours. Personally, I don't even use it at that point. Some of these others I will, but ice I just never use. Compression as well, right? When we compress the tissue, we're decreasing circulation to that area. I mean, it's 1 for 1, unfortunately. So I'm not a big fan of compression. Elevation as well. If you're elevating something, it's meant to help blood flow back to your heart, but fresh blood with all the nutrients and the immune cells and the stuff that helps you heal is having a much harder time getting there. So yeah, so that's why I am not a fan of this rice treatment overall. It really, really delays healing. You're actually fighting your body, right? You're fighting against this need for circulation and this need for the immune system to come in and cause a little bit more inflammation. I think that's another big misnomer that's not included in the rice kind of acronym there, is that on top of this, anti-inflammatory pain medications are recommended all the time, right? Tylenol, aspirin, ibuprofen, anything, maybe something stronger. But unfortunately, you need inflammation to heal. And I know that's hard to hear because it hurts. It's not comfortable, but it's so necessary to heal. That inflammation, those cytokines that cause the swelling and cause the pain, are what recruit your immune cells to come in and clean up that area. So when you have it, I mean, it's really, really necessary. Of course, at a certain point, you do want to control it, right? You don't want it to be super swollen and super painful, and that's kind of where meat and then a few things that I do come in. They really help to manage that inflammation level, so you're still getting this healing response without totally shutting it down, right? The anti-inflammatories do shut down that healing response pretty effectively. So again, you're fighting against your body and delaying it from actually healing and forming healthy repair tissue, right? You know, with injuries, the tissue that comes in is scar tissue. It's connective tissue, which is really interesting because connective tissue is pretty avascular, meaning it really doesn't have any blood vessels to speak of. So once that connective tissue is settled in there, it's there, and the body stops paying attention to it because there's no circulation going there. And then we get this really tight, contracted scar tissue that's difficult to move, and it can start, not only is it contracted locally, then it starts pulling on everything around it because we have so much connective tissue in our body, it's all connected from everywhere else. So that's where if you have an ankle injury, it can actually end up affecting your knee or your hip or even up to your shoulder sometimes. So making sure that this tissue gets healed in the right way so it's loose and flexible and pliable is really, really going to help you over the long term to avoid a lot of injuries down the line because the tissue is weakened and not healed, and then also subsequent joints being affected or areas of the body. So let's move on to meat, my preference for injury, for injury healing. So we've got movement, which again might not be relevant in the first 2 to 4 hours, but I do have to say, you know, with this guy, I was moving it within the first 2 minutes. You know, I was in shock for a little bit when it happened and fell. Fortunately, my husband was right there to get the painting off of or the art print off of my hand, which was lovely because it was quite heavy. I was within a couple minutes. I was moving it. I was making sure I was checking my range of motion, and that's really the key with movement, is that you check in, but you're not going to push that range of motion, right? You're seeing how far you can get. My pinky was the only thing that was a little bit decreased. It was a little bit swollen right in the joint here, and it was a little bit hard to kind of fully curl into into my fist here. But that's it. Everything else was just fine, which was a relief because this guy got a nice little scrape on it. I was worried about maybe that bone or tendon there, but it was totally fine. So with movement, it's an appropriate range of motion, but you do want to do a variety. So that's really important because that's how the scar tissue or healing tissue forms, right? Is if it's stagnant and not moving, it's going to form in this very small contracted bit. And then when you try to move, it's going to be pulling and tight and intense and painful. And then if you're only moving it in certain directions, like if you have, if you're doing your index finger, if you're only moving up and down rather than like the full rotation and side to side, that tissue is really only going to heal in a flexible way for that movement that you're practicing. That's why it's really important to get a lot of rotation and movement in every possible direction that you can. It's just testing it every day or every few hours to see, okay, can I do this now? Great, okay, I'll continue. Oh, that's way too painful. Great, not moving in that direction. So it really, it's not a particular prescription, do 10 exercises this way or 10 this way. It's really meant for you to kind of look internally and see what your pain tolerance is and your movement level and the movement direction that you can handle at that point. But again, this really helps to form this looser, more pliable connective tissue kind of scarring that happens in injury. And we want that to be as loose as possible. So exercise, right? Instead of resting, we want to kind of gently move into this exercise or movement more quickly, right? We don't want to be kind of stagnant for 6 to 8 weeks. We want to get that real world movement back as quickly as we can, and weight bearing if we can, unless you've got something going on with your foot. But even at that point, as soon as you can start to put weight back on it, the better, or move it, or use those muscles, because we're going to decrease muscle atrophy. We're going to help stabilize the joint by keeping those muscles tight and toned. And then, of course, we're going to improve circulation with the exercise and the movement, which is key. It's huge. And again, this is meant to be kind of slow and steady at your own pace, depending on the severity of the injury. But it is a wonderful thing to know about, and kind of permission. I think people get really restless when they're, bedridden for 6 weeks or have a big foot boot on for a long time. I really do think it's much more beneficial to get that movement and exercise flowing as soon as you can, really paying attention to your body. And when you're not taking pain meds, your body will tell you what your limits are. I think that's what's really important. I think a lot of people are very afraid of their limits, and that they'll push it too far and they'll re-injure themselves, and that is a real concern. You want to be aware of that. But I think having that trust in your body that it will tell you what you need to do is really, really important to tune into, right? You're the only one that's going to know, that can push yourself to get better or take a rest for that day, whatever it is. No doctor or physical therapist is going to be able to tell you exactly what to do. You are your own boss that way. So I think that's a really important thing to kind of start tuning into. So analgesia, I can't say that word. You know what I'm saying. So some pain management here. So my number one tip for pain management, not anti-inflammatories, please avoid those, but is cold water. That is so fabulous. This is the trick that naturopaths have known about for years, decades, hundreds of years, because the basis of our medicine is in these simple water therapies. And I think that's the thing. They're so simple that people discount them, but they're amazingly powerful and helpful. Really, if you give them a shot, it's really worth your while. I tell people the same thing all the time, and it really works. So the cold water is my replacement for ice. And that's exactly what I did immediately when I got this injury. So I put it in, I got a bowl of cold water going, put a couple ice cubes in it, dunked my fist in, held it there for a bit. So definitely not the 15 to 20 minutes. That's kind of the misnomer with cold application. Rule number one with cold application, you always want to be warm. That's the thing. If you're cold already and you put your hand or your foot or whatever's injured into something cold, you're going to shut down circulation just like ice. But if you're warm, which often happens when you're inflamed, which did for me, right? My hand was pretty toasty and it was starting to swell up. If you put it in cold, it doesn't shut down circulation. So what's really neat is that the cold will contract the vessels, right? So it acts like this kind of giant sponge, for me in particular in my hand, right? That it will help the veins, which are a low pressure system, return blood to the heart, right? And then you get this reflex effect that happens, which is really neat. Your brain gets the signal like, wow, my hand is cold. What's going on here? So then it will shunt more blood down to that area. So that's what's really neat about doing short applications of cold, is that you kind of sponge out all of this inflammation and the swelling comes down, and then you get this rush of nutrients and warmth, and your hand actually stays warmer longer if you do a short cold application than if you had just done a hot application, which is pretty neat for your whole body, really, not just your hand. That was just my hand, but yeah, so that is by far my favorite treatment. I would do probably 2 minutes at a time, it all depends on how cold the water is and how cold you're feeling your hand is. You don't want it to be numb. You really don't. You don't want to shut down circulation completely. So I would kind of let it rest in there for a couple minutes, maybe up to 3 or 4 sometimes, because I did have more. It was pretty hot with the acute inflammation. And then you leave it out for at least a minute, and you can feel this warmth come back to your hand. And when you start to feel that warmth come back, let it be there for a little bit, and then you do another round of cold. And the more rounds of cold that you do, the more the inflammation comes down and the warmer your hand gets from the increased blood and circulation. So I have to say that by doing that, I woke up the next morning with no bruising, with no swelling. Well, I lied. There was a little bit of swelling here. The next day, my joint was kind of moving it like this. There was a little bit of popping. After 2 hours of moving around, it was totally fine. So, and I never actually formed a bruise. It got a little bit yellow here and a little bit yellow here, and that's it. It was pretty incredible. I was really, really excited about it, of course. So yeah, so that's my number one kind of pain relief trick. You can do it as many times as you want. You can do it as often as you want. It's just cold water. Try out just cold water. Add some ice if you want, if you need it colder, but just a couple ice cubes floating. I guess that's my only application of ice, no direct application of ice. And there is really something about the water rather than this dry kind of application of ice. The water is really massively helpful because it's also going to hydrate the tissues, which you need. So my last pillar here is treatment. So in terms of treatment, I really love acupuncture, of course, since I am one. I love the cold water. That was my main treatment. I did do one other little thing. Immediately after it fell on my hand, I came down to my office here and took arnica, which is a fantastic homeopathic. If you guys have never had it, it's really worth having on hand for any acute injuries. It's specific for trauma, so it helps to clear that out of the body, and then also bruising in particular. I think that's another reason why this bruise never really formed significantly. So bruising superficially, and then it's specific for the feeling bruise, like you have to toss and turn, you just can't get comfortable, or you're just, it just feels bruised. So arnica is lovely to take. I would recommend probably the 30C kind of potency or dose 3 times a day. Does not interact with any other medications. Super simple. Pop a couple pills under your tongue. They're little sugar tablets, essentially, so they even taste good. It's exciting. And that will really help bring down the bruising and the trauma and the swelling and all kinds of stuff and help you heal. So those are my main kind of healing points. I did also use a really nice calendula cream to help heal up kind of the scars here, which I love. So that's it, I think. That was pretty comprehensive. I really hope this helped. I hope that was clear enough as to how I use the cold water, and that it is short duration cold, 2 to 4 minutes at the most, to start out with. Again, you can listen to your own body, and then let your hand or area, whatever you're treating, warm up in the meantime. For a little bit, and you can feel the temperature of your skin. That's a really important thing to do, right? You can see that, oh, my hand is kind of white and cold, and oh, look, now it's back to red, and it's got some color back into it. So yeah, you just don't want to make it too cold overall. And if you feel like it's getting too cold where it's painful, great, okay, back off with the cold. Let your body warm it up a little bit more. And you can do a couple rounds of that. I'm sorry I don't have more specifics. It's really individual. I think I probably did 4 or 5 rounds until I really felt the swelling come down. And some of the coloring was better, and the bruising was pretty mild. So but cold water instead of ice would be the take-home message, and it really, really does work, the cold water, as long as you let your body warm up in the meantime. It's really fabulous for healing. I did have another patient who followed kind of these recommendations. She had broken her pinky, and she went back to the orthopedist about 2 months earlier than they thought it would be healed, and it was completely and totally healed, and they really did not know what to do about that. So, and she stuck with the water therapy every day. And it made a massive difference for her, as well as kind of the meat principles with that movement and exercise as well. Okay, all right, well, feel free to leave me some comments if you'd like. If you kind of want to know more about me and about this, feel free to sign up for my newsletter at drlizcarter.com. On the contact page, you can just sign up right there. Otherwise, I will see you guys again soon. Thanks so much. Take care. Bye.